Namaste, I'm Dr. Siddhart Yadav, Orthopedic and Joint Replacement Surgeon at Apollo Hospital, Navi Mumbai. Today we are going to talk about knee replacement. What is knee replacement? Who needs knee replacement? And what is latest in knee replacement? So first of all, every knee arthritis patient does not need operation. Operation is only done in stage 3 and 4. There are 4 stages of arthritis. Stage 1, 2, 3, 4. Stage 1 and 2, which is most common, knee replacement is not required. And these early arthritis is managed by weight reduction, medication, gel injection or autologous protein solution injection, exercises. And after that, if arthritis is very severe, it is very painful, somebody is not able to walk, somebody needs everyday painkillers. In X-ray, it is showing it has arthritis of stage 3 and 4. Then knee replacement is advised. Now, in what latest we are doing here is we have now acquired a knee robot also. It's called Rosa, which is the latest knee robot. And we are using US FDA implant, which has maximum size. It's called Persona. So every knee is a different size, and it has 10 sizes. So it matches the as per the natural knee. And when we put exactly same size of natural knee, then we get better result. After knee replacement, most common the complaint or patient fear factor is pain. We make sure by our pain management team, we do multi-modal pain approach. We use different technique to reduce pain. And majority of time, maximum time, patient do not feel much pain, and they get very pleasant experience because they have minimal pain or no pain. So their recovery is very fast. They normally discharge in 3 days. And our wound healing, our wound complication, stitches problem is almost nil because we have a special operation theater. We do very good soft tissue handling. So our wound complication or other complication rate is very less. So knee replacement is very safe, very successful. Do not scare of any surgery or you should not have any fear factor. There are many patients operated by us. You can contact them, have a good survey before coming, and do not scare of surgery. It is a very successful surgery nowadays. Thank you.